In this video, I'm going to be demonstrating and explaining the purpose of the anterior head weight. Now, the purpose of this head weight is to bring the forward head carriage backwards. And what I mean by forward head carriage is that the ear should be directly over the shoulders. But because of our lifestyle that we live today, technology use, but even traumas, car accidents, whiplash, things of that sort, what can happen over time is that the head shifts forward. As the head shifts forward, it stretches the ligaments on the back of the neck, puts abnormal pressure on the joints, and it causes other deleterious effects to happen, which can lead to pain, discomfort, and disability. So our goal is to be able to get the head to come backwards. So as counterintuitive as it may seem, putting weights on the front of the head, if your head is forward, putting weight on the front of the forehead actually causes the body to have a righting reflex where the body wants to correct that abnormal position or posture because of the forward head carriage. So you put a weight on the head and the body's automatically going to contract these muscles to pull the head backwards to resist the weight on the front of the head. And whenever we do that, that strengthens some of the posterior chain muscles to be able to hold the head back in the proper position. Pair this exercise and the other exercises with the corrective adjustments to be able to restore better range of motion. That's going to allow us to bring the head back as far as possible, strengthen the muscles to hold it in the right place. So the head weight, which comes in your home care kit, comes with 3 pounds of weight in it. Now, I'm not going to demonstrate how to put this together on this video. That is on the video explaining the home care kit. So please watch that video if you need an explanation on how to set the head weight up. But there are 3 pounds of these weights in. Each one of these weights is a half a pound. So there's 6 bars in this. Most of my patients, you're using 2 pounds, which is 4 bars. So you would simply take the outside bars out, just use the 4 in the middle. Now, you should know which or how much weight you should be using because I prescribed it for you. So to do this exercise, all I'm simply going to do is put the weight on my forehead, and I'm going to tighten the Velcro and then Velcro it. There we go. It's centered for me. So what I'm going to do, if you're in the office, we have the vibrating platforms. And the purpose of the vibrating platforms is that while you're doing this exercises, it's stimulating the joints and the muscles, which sends something called proprioceptive input up to the brain, which actually helps to increase the benefit of this exercise. So when you're here in the office, you just stand on the vibrating platforms. The goal is to work up to 5 minutes here in the office. Whenever you're at home, assuming you don't have a vibrating platform in your house, you're going to be marching in place. So you'll just wear the head weight and you just march in place. Now, for patients, there's some patients in the office that I have doing this for various, they have various issues, pregnancy, some other issues, they'll do this in the office as well. But when you're at home, you're going to march in place. The goal is to get to 10 minutes per day, especially at the beginning of care here in the office. You're going to do 10 minutes per day. You can split that up, do 2 5-minute sessions, but you want to work up to those 10 minutes. If you have any questions on how to use the head weight, why you're using the head weight, please don't hesitate to ask.